Hello, and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita, and I will be here today. Ron is not going to be joining us, though.
That was Jean.
Oh, that was me, Jean Marie.
Oh, boy.
And that's Lita.
God. Collectively, we're the crew of PodcastDX. On today's show, we're going to talk about thrombus, also known as blood clots.
Don't you say thrombosis?
No, thrombus.
Okay. Sure, we'll go with that.
Blood clot, or thrombus, is a common term. No, blood clot is a common term that you hear safety measures for, like long plane rides and blood clots forming in the leg because you're sitting too long.
I hear blood clot as in saved my life when I was bleeding and then the blood clotted.
Oh, yeah.
But blood clots can form anywhere in that there are blood vessels. And a blood clot is a semisolid bunch of blood cells, proteins, and platelets that form in the blood vessels to protect you from bleeding too much if you're injured, have a cut, something like that, or are having, like, let's say, surgery.
So they can be helpful in the right conditions.
Sure. If you have a medical condition that causes blood clots, though, abnormal blood clots, they can be dangerous rather than beneficial. Some causes of abnormal blood clots include if you're having blood flow issues. So, if you're having inflammation of a valve in your blood vessel, especially like the heart, that can result in abnormal blood clots. Or if you have an aneurysm, which is a weakened area in an artery, that can cause unusual blood flow variations and for blood to pool in that area. There are blood clotting disorders that can be inherited or acquired later in life. There's something called sticky platelet syndrome.
Right. Okay. Well, other causes of abnormal blood clots are medical conditions like AFib, which we talked about a couple of weeks ago, atrial fibrillation. Also cancer, chronic inflammation, diabetes, hypertension, high cholesterol, obesity, having Ehlers-Danlos syndrome.
Oh, sickle cell syndrome, or sickle cell disease. That's what I was trying to think of.
Or sickle cell disease.
Okay.
All of these can increase the risk of blood clots.
And surprisingly, estrogen. So like during pregnancy, also birth control medications that contain, those are hormones that can cause an increase in blood clots. And hormone replacement therapy can also increase one's risk of having blood clots.
Right.
Abnormal blood clots.
Right.
And as we alluded to at the start of the show, for example, like you hear about blood clots with long plane rides, but really it's any inactivity. So inactivity. Like if you're confined to a bed, if you're sitting for long periods of time on a drive, on a plane, on a train, in the rain.
At a desk. With a mess.
Yep. Okay. Then you are at an increased risk of developing blood clots. And the last item on this list is smoking, tobacco or marijuana. And that can alter your platelet function and lead to increased clotting. And of note, recently, COVID-19 has also shown to be responsible for some abnormal blood clots.
I didn't know that blood clots can form in the blood vessels of the limbs, lungs, brain, heart, and kidneys.
We've had like 2 out of 3 or 2 out of 4 of those.
Well, I've had 7, one in my arm, which was considered a deep vein thrombosis or a DVT. That was over a decade ago. And then 6 more in the last 2 years.
Just to keep the first one's company.
1 in my lung called a pulmonary embolism after my Nissen fundoplication. 3 in my head, most likely caused by a blood clot elsewhere in the body that broke free and traveled to the brain. These happened a week after my bowel resection this summer. And in the past 2 weeks, I had 1 in my calf. This would have been a DVT, like the one in my arm, and 1 in my foot. And I don't know if they call that a DVT or not. But what I am thankful for is I haven't had 1 in my remaining kidney or my heart.
Okay.
And the 3 in my brain were small enough to not cause any long-term damage. So I kind of lucked out.
Okay. And
Go ahead.
go ahead.
I found a resource article on healthline.com,
Okay.
which lists the different types of venous thrombosis,
Okay.
including superior vena cava thrombosis.
So you're talking about these are describing based on the location, the anatomical location
Right.
of
That's
the blood clot.
That's why they're named that.
Okay.
A jugular vein thrombosis,
Mm-hmm.
a cerebral venous sinus thrombosis,
Mm-hmm.
a cavernous sinus thrombosis, a retinal vein occlusion, a femoral vein thrombosis, a portal vein thrombosis, Budd-Chiari syndrome, which has nothing to do with Chiari. Isn't that something?
Well, Chiari is named after a person, so
Okay. Renal vein
a healthcare
thrombosis
provider. Mm-hmm.
and popliteal vein thrombosis.
Okay.
Other types include, but are not limited to, tumoral thrombosis, transverse sinus thrombosis, superior sagittal sinus thrombosis, portal vein thrombosis. I already said popliteal vein thrombosis.
Mm-hmm.
Intracardiac thrombosis, cerebral venous thrombosis, and coronary thrombosis. I'll put a chart on our website explaining each, and like Jean said, they're based on the location of the blood
Right.
clot.
So your symptoms might be specific based on the location where you're having a blood clot.
Right.
So, for example, chest pain that worsens when lying down or taking a deep breath. Coughing or coughing up blood might be a sign that you're having a blood clot. Irregular or faster than normal heartbeat, pain or tenderness in the arms or the legs, along with swelling in the arms and legs or a warm feeling in the arms and the legs. You also might have trouble speaking, vision changes, sudden strong headache, or even dizziness. And what can you do to reduce your risk of blood clots? And what do you do if you have a blood clot?
Well, to reduce the risk,
Mm-hmm.
it's important to adopt a healthy lifestyle habit.
Okay.
Stay active
Yeah.
by getting up and moving every 1 to 2 hours, especially if you're sitting for extended periods.
So, like if you're on an airplane or in a car or in a
Or at your
train or
desk.
at your desk. Yep.
If traveling, aim to walk around every 2 to 3 hours. If you're seated in an aisle, like on a plane or a bus, wearing compression
But
stockings.
even if you're not seated in an aisle, you still want to do that.
Well, I guess, okay.
Yeah.
I'm just thinking that people that are sitting on the aisle have a better chance to get up and move
Well, when
around.
they get up, you get up too. And
Some
yeah.
people just never get up.
I know, but then you're increasing your risk. So
All
we're
right.
trying to reduce your risk.
But you could wear compression stockings that will improve blood flow in your legs.
How's that going for you?
Good. And regular exercises such as flexing and extending your knees and ankles can further help.
Have you put them on yet?
Maintaining a heart-healthy diet rich in fruits, vegetables, and whole grains, while limiting salt and red meat. Manage your weight, as being overweight increases the risk of clot-related conditions. Stress management is also crucial.
How's that going?
As stress can elevate blood pressure and contribute to heart disease risk. Quitting smoking is essential, as it significantly raises the risk of blood clots. And staying hydrated by drinking plenty of water helps prevent dehydration.
And keeps, the blood flowing because
Right,
blood
'cause
is mostly water.
It'll be thicker when you're dehydrated.
Yep.
Lastly, take any prescribed anticoagulant medications as directed by your doctor to reduce further blood clot risk.
And if your doctor they might request that you have testing done on a regular basis to make sure that the medication is working, because in some individuals who have, let's just say, for example, have had intestinal surgery or have issues with digestion, the blood clotting medication might not process through their system the same way that it does other individual systems, or it may transit through quicker and not be absorbed into the bloodstream, and so it might not be doing the work that you think it is. And in those cases, there are alternatives such as injectable anticoagulant medications.
Okay, well, I guess that leaves us with the question, How are blood clots treated? Can you-
Well, first of all, DVTs and pulmonary embolisms can take several months to dissolve depending on the clot size, location, and the overall health of the patient. And so in these cases, they occur, like I say, we were talking about they might be in the leg or like in your pelvis or like in your arm or your shoulder. And then pulmonary embolisms, as we had said, they usually, usually when you have a DVT and it breaks off and then it travels to your lungs. So these are typically the most life-threatening without proper treatment. And your doctor might prescribe blood-thinning medications, such as we were saying, heparin is one, warfarin is another, Coumadin. So they can help the blood flow around the clot as well as preventing it from traveling to the lungs. And these medications and your body's natural defenses kind of can work to dissolve the clot. But there's also surgical procedures that can remove it if that's necessary.
Okay.
But another medicine that can be prescribed are, they're known in the category as like clot busters. And these are used for more serious clots if other therapies aren't working. And they are given through a catheter or a thin tube that is placed into the clot. And because these can cause severe bleeding, they're only used in incidents or patients that have severe clots and life-threatening clots.
Okay.
And as we had said before, compression stockings can help. How are those going with how are
really
you?
well.
Yeah.
The
Have they left your dresser?
the compression is holding the dresser down.
Okay, and they're colorful, so they're adding color to your room. But you could actually put those on your legs and see how they help.
Okay.
And as we said, if you have a larger or blood clot, then you might have to have surgery for it. And then there's also a device out there called the vena cava filter, which sometimes they use that. They insert that into abdominal veins, which are a larger vein, and they can help like capture or filter out blood clots.
Okay. Well, that wraps up this episode.
Okay, and we'll have a lot more information on our website.
Okay, sounds good. If you would like to be a guest on our show, please drop us a line at info@PodcastDX.com. And if you have a moment to spare, please give us a review wherever you get your podcast.
Okay. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. And before undertaking a new healthcare regime, endeavor to disregard professional medical advice or delay in seeking it because of something you've heard on this podcast. If you think you have a blood clot, you might need emergency services. So you might need to go immediately to, the ER or call for an ambulance, as we have done several times in the past year.
Okay, till next week.